The book is going to coincide more or less with the publication of a public inquiry into events at the Mid Staffordshire NHS Foundation Trust. This was the trust which attracted attention finally from the regulatory body, because there were apparently a great many deaths occurring there. The reported mortality rates appear to be far higher than they should have been. But Mid Staffordshire isn't just about the deaths, of which there may have been many, many hundreds which in principle were avoidable. It is just as much, even for those people who may not have died, about the terrible, undignified care that was visited upon many patients there, care which we know already from the independent inquiry was inhumane in the extreme. It's the Mid Staffordshire Trust that will be most of all in the public eye, and the book does make considerable reference to what we know about Mid Staffordshire already, but it would be a mistake to see Mid Staffordshire as the beginning and the end of all the problems. Mid Staffordshire, in fact, could almost logically have been predicted, because we've been heading towards Mid Staffordshire for many, many years. There are a number of more minor, if minor is the right word, scandals during the 2000s. It's the Mid Staffordshire that appears to be the most extreme. But one of the points the book makes is that the trusts, the hospitals that we do know about where things have gone badly wrong, are not necessarily the end of the story, because there's almost certainly large quantities of very poor and neglectful care that have taken place and are taking place which we don't actually know about. And one very interesting point about Mid Staffordshire is that although the Healthcare Commission became involved a couple of years ago and published a report, had it not been for a group of very, very determined relatives, there would have been no independent inquiry and there would have been no public inquiry, in which case Mid Staffordshire would by now have died down and business would have gone on as usual. So the Mid Staffordshire inquiry is very, very important. It would be a big mistake to concentrate only and too closely on Mid Staffordshire. We have to look at the much wider picture, of which Mid Staffordshire is a particular part.